Joining us today is Dr. Anthony Fauci. He is the director of the National Institute of Allergy and Infectious Diseases, an organization most people before 2020, if they were outside of the medical field, probably had never heard of, but he has become a household name, and he is going to be in Louisville receiving a Muhammad Ali Humanitarian Award. He'll be getting the Lifetime Achievement Award as part of the upcoming ceremonies. Just and it's all coming as you have announced that you will be wrapping up your this phase of your career, but not necessarily exiting government. So, what does that award from a group like the Ali Center mean to you?
Well, it means a lot to me for a number of reasons. That uh, one always gets a kind of humble pleasure, if I call it that. It's always humbling when you get an award for doing something that is the job that you've decided you were going to do with your life, that other people recognize that you have achieved some degree of accomplishment in that. So that makes me feel good. Um, but the fact that it comes under the name and the umbrella of Muhammad Ali is particularly important to me, because that is an individual who I have admired for a very, very long period of time, a person who is of extraordinary, in many respects, unprecedented athletic prowess, who at the same time lived a life that was founded in fundamental principles of sticking to his own convictions, regardless of what negative impact it would have on him. A really, truly courageous public figure. And when you get an award that's named after someone whose life and principles have been so admirable, that makes it a very extra special feeling. That is a very pleasant feeling. As I mentioned, it's a bit humbling when you get an award for things like that. So I'm looking forward to it, and I will accept it with a great deal of gratitude.
When you look back at your career and the presidents that you have served, 7 of them to date, and the medical advancements over that time period, could you have imagined your role and the role of the National Institutes of Health being what they are today when you first started?
No, absolutely not. Um, I think the evolution of my life and my career is an example of what I refer to as expect the unexpected, and leave your mind open for opportunities that will be put in front of you that you never anticipated, that would change the course and the direction of your life. When I came to the NIH, I was a 27-year-old newly minted physician who just finished their residency training at a hospital in New York City. And I came down to the NIH for a 3-year fellowship in infectious diseases, with the full intention of going back to New York City and practicing medicine in a hospital in the east side of New York City. As it turned out, I fell in love with the concept of doing basic and clinical research to benefit not only the individual patient, but to benefit large numbers of patients. And then from there, I got involved in HIV/AIDS, which was unexpected, which changed the direction of my career. And then when I became director of the Institute, I had the opportunity to have impact on multiple areas of global health, including malaria, tuberculosis, and now COVID-19. So it is really an example of how things evolve well beyond what your ultimate and initial plans were.
To kind of follow up on that, and you mentioned COVID-19 and how things change and evolve. As far as the viruses and infectious diseases that you've seen, how was the challenge of first learning about COVID-19 and then adapting to COVID-19 different from the other viruses you had come across?
Yeah, because more so than others, when you're dealing with a new virus, there generally is a feeling of uncertainty in the very beginning until you know about what's happening with it. We've seen that with HIV. We saw that with Ebola. We've seen that with others. But COVID was truly unique in that it evolved in a way that we first, for example, thought, at least from the information we were getting from China, that it was very poorly transmitted from person to person, and made us think that it was similar to the original SARS-CoV-1 that we confronted in 2002, and very easily after a year had it under control with 8,000 cases and 780 deaths, because it didn't transmit very well and it could easily be controlled by public health measures. We thought that this was going to be somewhat similar. As it turned out, it was completely different. And as the weeks unfolded, from January of 2020 to February and March and April, it became clear we were dealing with a completely different situation. We had a virus that was highly transmissible, that was the capability of killing literally millions of people. We know in the United States it's already killed over 1 million people, but it also transmitted in a way that most of the transmissions were from people who had no symptoms. So it was a completely new paradigm. And as the weeks and months went by, we kept on getting more surprises by this virus. And to this day, we're still living with surprises, like the continual evolution of new variants. 3 years into the outbreak, we're talking about the latest variant that's come along. We've never had a virus that challenged us like this.
When you're at this point in your career and you're talking about kind of stepping into a new phase, is that more difficult when it's happening, when you've got all these developments with COVID and you kind of, I guess it's human nature to want closure on a project? Is it difficult to kind of take that next step, knowing that if there is a end or eradication of COVID, that it may be way down the road?
Well, I can tell you then that's a very good question, Will, because I did examine that in my decision of when to step down from the government. I'm still going to be involved in public health, so I'm not walking away from COVID or any of the other diseases. I'll still be involved only outside of the confines of the government, but we are not going to eradicate COVID. That's not going to happen. We've only eradicated one virus in the history of global health, and that's smallpox. And we did that because that's a virus that doesn't change. And when you get immunity to it, it's strong and it's durable. That's not the situation with COVID. We're not even going to eliminate COVID, because we eliminated in this country, for example, measles and polio, again, because both of those viruses don't change very much. They don't have multiple variants. It's the same virus. And the immunity that you get from either infection and or vaccination is very durable, measured in decades of years. With COVID, the best we're going to do is learn to get it to a very, very low level, what some people refer to as endemicity, where we're able to live with it at a low enough level that it doesn't disrupt the social order, doesn't disrupt the economy, our social interactions, our educational interactions. I believe we are going in that direction. If I stayed around until COVID was totally gone, I would probably be 100 years old, because it's not going to be totally gone. We're going to have to get it to a very low level that it doesn't disrupt us. And that's the reason I decided I might as well step down at a point when I still have enough energy and good health to do something else.
With us is Dr. Anthony Fauci. He is the director of the National Institute of Allergy and Infectious Diseases. One last question for you. Vaccines have become a very hot button issue. Has it surprised you that the kind of that line between medical studies, healthcare, and politics, political stances has blurred and in some cases completely disappeared, especially when it comes to things like vaccines?
Yes, I've been surprised and very saddened by the interjection of political ideology into issues of health. There is no reason whatsoever that the uptake of vaccine, which is associated with saving lives and preventing suffering, that the uptake of vaccines is much better in red states than, excuse me, much better in blue states than in red states. And red states have much more of a pushback against vaccination. And that's unfortunate because you want people of any political persuasion to be equally protected against a disease that can kill you. And it's very sad that people, because of political ideology, don't afford themselves the benefit of getting vaccinated. And you look at the numbers, they don't lie. It's not an opinion, is that the difference in death and suffering among unvaccinated people versus vaccinated people, it's profoundly different. And the difference in uptake of vaccine among Republicans versus Democrats is also very different. And we don't want to see anyone suffer, whether they're Republican or Democrat. And unfortunately, political ideology has crept into some decisions regarding public health.
And actually, Dr. Fauci, I do have one more quick question before we let you go. You are, of course, coming to town for a Lifetime Achievement Award from the Muhammad Ali Center. As you wrap up your government service, but not leaving public health, do you leave with any substantial regret, or did you kind of check all the boxes you wanted to check?
Well, I wouldn't say regret. I would have liked to have come to closure on some of the diseases I've devoted almost 6 decades to, like malaria and tuberculosis and HIV. Even though we've made substantial progress in it, I really would have liked to have really put an end to those terrible scourges, which I have not been able to see to its full ending, even though we've done much, much better with them.
That is Dr. Anthony Fauci. He's the director of the National Institute of Allergy and Infectious Diseases. He is coming to Louisville as part of the Muhammad Ali Humanitarian Awards, where he will get a Lifetime Achievement Award. Dr. Fauci, congratulations on that and on your career, and thanks for talking with us today.
Good to be with you, Will. Thank you for having me.